Hi, Esther.
Hi.
Hi, everyone, and welcome to our Golden Resource webinar. We do these webinars for caregivers and seniors and community members who can benefit from professionals that speak on very complex topics. So tonight, we're very excited to have 4 professionals in the area of alternative medicine. Many people, unfortunately, are struggling with chronic pain, inflammatory diseases, chronic conditions that have not been able to get the relief and quality of life they want from regular, typical medicine from their other medical providers. So we want to learn about other options that I think are becoming much more popular lately. People are starting to realize that there's much more out there, more natural remedies to help with certain stressful things, certain complex conditions. As a disclaimer, always consult with your medical provider before doing anything, because sometimes different things can interfere with the other medication, and we want to make sure that everyone is doing what's best for them. So yeah, always consult with your doctor. So we have 4 presenters tonight. We have Dr. Robert Bello. We have Scott Nause, we have Aliza Dubin and Kevin Neblung. And we're very excited to have them. They're all within local distance. So if you're interested in learning more about their practices, I'll ask you guys to maybe put it on the chat so everyone can take a look. And I want to just introduce and thank our first presenter for tonight, Dr. Robert Bello. He's been practicing as a chiropractor for 15 years, and he has 2 offices, one in Clifton, and the second one is in Waldwick, I believe, New Jersey.
Correct.
And he's passionate about helping his patients get relief. So if you can please just give us an overview of what you do and how you help your patients. And we will then have time for questions with Dr. Bello for whoever has questions on what he's speaking about.
Great.
I'm going to
Thank you
spotlight
very
you now.
much. So thank you everyone for coming. It's I know it's later on a weekday, so but today's world is never a good time, right? So we are like Sarah was saying, I am a chiropractor. I've been practicing for 15 years. I'm also board certified in physical therapy. I have a certificate for dry needling, although we don't really do that anymore. And Scott will speak later. That's why we brought an acupuncturist in the office. So, our style of treating is basically everything starts with, traditional chiropractic. We know that's very powerful, and we take care of patient populations from 2 years old to 92. So not everybody gets the same treatment. It's a very different treatment for a 2-year-old as it is a 92-year-old, and everything in between. But the chiropractic is the cornerstone of our treatment protocol, but we know that, especially like Sarah was saying, people are struggling with a multitude of issues. And she hit the word on the head: inflammation. Our lifestyles are very inflammatory. What we're eating, stress. So, as a chiropractor, to just do chiropractic is difficult. You're not seeing the success rate that you might used to when people were just eating clean food made at home. So we've taken a multi-level approach. Um, so the chiropractic, like I said, is kind of the first thing we do, but I'm always incorporating, my physical, as a board certified physical therapist. I don't do, I believe in being a specialist. I have added value to the work that we do in the office. So I do always work with my patients as far as the movement aspect. What we do in chiropractic is a passive treatment. You come I do something to you, you leave. But we know the active portion of keeping that all together is very important, especially at first when someone comes in, if they're in a lot of pain. What we're doing treatment wise, chiropractic, the acupuncture that we do in the office is very important. And once the pain starts to get better, then we start to focus a little bit more on movement. So, we do, especially in the Clifton office, I have, sort of a gym facility in the back, and we work with people and how to move, and different people that have different experience levels with either being a gym person or never going to the gym. Some of those people will send right to a physical therapist. Like I said, I believe in a specialist. If someone seems like they can do some home exercises, and then we start off very simple. Everything is progressive. I try to give everybody their movement homework as things that don't need equipment that you can do in your home, right? If I have to, the more things that I give you, if you have to go to a gym to do it, it becomes impediments to your compliance, right? So we want to increase compliance as much as possible. So these are general lifestyle, how to sit better, how to sleep better, how to walk better, different, kind of stretches, different activations you should be doing to kind of warm up the muscles. A lot of times, people think we have to stretch our way out of pain. More often, it's actually something where people are need more movement. They need to activate these muscles. So we really like to coach people on that. And then the acupuncture part of it is really key. Like I said, I got board certified in what's called dry needling, or it's trigger point acupuncture, and it's an acupuncture in the site of pain, which is very different than what Scott does as a full blown acupuncturist. So we've seen synergy in approaching things from different perspectives. Some people do great with the chiropractic, and then the acupuncture may be just kind of, help out with that last percentage. And then there are other people that the chiropractic isn't doing the heavy lifting, that they really need the acupuncture first, and then that kind of lays the ground for us to really get a good chiropractic adjustment in. And I have all sorts of history as far as nutrition. I've done a lot of advanced nutritional work with autoimmune type conditions. So I don't I've chosen not to primarily practice like that, but I do have a litany of information to help people. I can get people set up with sort of autoimmune, anti-inflammatory type diets. We have some of the supplements to support that. And then again, if it's something that needs a real specialist, I believe in referring out. I want people to get better. If it's in my office, that's great. If it's co-managing with someone else, that's great as well. Our my key is my goal is to have everybody get better. And if my part of it is just referring them out somewhere and they come to me as for maintenance, that's key as well. And over the last 2 years, we've implemented a really powerful intervention into the practice. Some people might have heard of peptides. Peptides are a kind of newer in the health and wellness world um, dialogue, but they've been around for a very long time. The peptides that we use are an oral form, and they have been around for 30 years. I've been using a particular peptide. It's called BPC 157. That is probably the most universally used peptide, and that is, we've done so well with that I actually have manufactured my own product, and I was just at a conference in Las Vegas where we are connecting providers with the product because the patient outcomes with it is fantastic, and all the peptide it really is something that we make in our body, that we just sort of make a bioidentical of. So a peptide is a just a chain of amino acids. It's either 50 amino acids or less, and they're just put together in the sequence that the body does. We just mimic that, and because it's something that the body makes, the body recognizes it very readily and uses it very readily. So they all have these fancy names. We actually just use two. We keep it very simple, but they're literal hundreds. Pardon me, there are many that are only injectable. These particular ones that we use are oral and they work great, so it's much easier for people to use. But the one is called BPC 157, and there you go. It's on my shirt right here. It'll always be advertising. But it is ubiquitous as far as inflammation, right? It is a potent anti-inflammatory. It travels to the area of injury. It creates more blood vessels. It creates more collagen. So it's perfect in the chiropractic and physical rehabilitation space because it helps these ligament, joint, tendon, muscle injuries heal at an increased rate. I work with a lot of orthopedic surgeons to, use these before a surgical operation, after, and the results that we've been getting have been phenomenal. I mean, I've shipped all over the world: Canada, Israel, Puerto Rico, Australia. It's been fantastic, and because it's something that's kind of hot in the world, you see this compound popping up in all these different places. If you have your phone on right now, you might start getting ads for it, in your social media. And there's a lot of these marketing companies that produce this because it's kind of, a real hot topic. But our product is my product. I take it from manufacturing start to finish, and um, I've really catered this product to patients' needs, right? So a lot of these other companies are profit centered. We're kind of patient centered. It was just for me and my family and my patients first, and we did so well that now we brought it out, uh, to the population at whole. So we've seen, this is something that naturopaths and integrative medicine doctors have used for years for gut issues. The BPC is something that we make in our gut naturally, so one of its primary jobs is to heal the gut. But it is systemic. It runs throughout the body. Like I said, it gets pulled over to the area of injury because of the inflammatory markers there, and then it automatically does the work there. So it's we've made sure, because it is for my patients. I have a lot of sensitive autoimmune patients, that we have made it a very clean product. So taking out any fillers, and so it's been a real game changer. And at the conference we were at, it was a chiropractic conference and expo, and four of the keynote speakers brought it up independently on their own, because it's been what they've explained as a game changer in their practices and lives. So yeah, so I think my time is up, because I could talk about this for much longer, and I do every day. But yeah, if obviously if anybody has any interest in our what we do at the office, our approaches, the products, I'm sure somewhere in this presentation you'll be able to reach out.
Thank you so much, Dr. Bello. I feel like you really used that time and really gave us a very nice overview. Um, I would love to open it up for questions. I see that there's one question in the chat box of, do you take insurance?
We do work with insurance. We're not in network with all plans, but we are in network with some plans. And the way insurance has gone recently in the last many years is that often, if I'm not in network with your insurance, my cash fee generally can be cheaper than some people's copay. And the insurance world is very confusing and convoluted, I think, by design. But we will kind of help people sort it out. The best thing to do is contact the office, and we do take Medicare. I see that question. We do work with Medicare, but the best thing to do is you reach out to the office, and Pam is our leader in the insurance world, and she will sort through it. And before you ever walk into the office, we'll tell you, okay, this is what you would have to pay out of pocket, whether it be a copay, whether it be a cash fee. So, what I generally do some from a meeting like this, if we have someone whose insurance isn't covered, if there's an examination fee, we'll generally waive the examination fee and just charge you the per visit fee. And I saw another one, where are we located? And we are located on Clifton Ave, across from the 7-Eleven, right next to the police station, right on the train tracks. It's that old red building. It looks like it actually was the original train station. It looks like an old schoolhouse or something. Um, and then, I mean, the but someone asked mentioned, how to teach how to sit, sleep, and walk better. Elaborate. Well, that's a whole nother discussion. But it's just proper mechanics in anything you do. How to lift properly, how to sit properly. I mean, some people that are have to sit for their work. If they don't have the mouse at the right position, the seat right, if they don't have their shoulders back, if there's certain things that you have to have in place mechanically, with anything you do for a long period of time. So we know we all sleep for a long period of time, right? Hopefully. And with that, proper sleeping is a big difference. If you sleep the wrong way, you could be increasing a rotator cuff irritation, or low back situation. So yeah, that's in anything, your mechanics, how your body's positioned. We're in a gravity environment, and gravity's pulling down us all the time, and will irritate, especially if we're not positioned correctly. You ever hear of the word text neck, right? This is something that is driving a lot of people into our office because of all the uh, laptops and cell phones, and so yeah. So that, again, that we could go down a very deep rabbit hole with that. But when you come into the office, because I'm sure you will, that is something that we always address. Because if I get you aligned and acupunctured and everything great, and then you go out and then you're walking, with a terrible posture, it's just gonna reverse everything we've done. So I think those are all the questions that I see here. And but again, please, I have to run off and put a 3-year-old to bed right now. So any other questions, concerns, anything you want to know about, always please. Oh, there you go. And my office number was just posted there. I appreciate that. Yeah, please reach out, and we'd be happy to help with you. Before you ever step in the office, I'll have a consult with you and kind of explain what we do, and see what your issue is, and see if we can help you, or other, like I said, if I have to refer you somewhere else, I always take pride in my referrals, that we're going to send you to the best place, if it's not going to be done in my office.
Thank you so much, Dr. Bello, for giving your time here. I
Of
really
course.
appreciate it, and happy to refer. So
Yeah, please,
thank you.
please. Yeah, we have a lot of members of the community in the practice. I took over a practice 8 years ago, Dr. Brewster in Passaic Park. So we've been able to really serve the community locally, and yeah, we will plan on continuing doing that for a long time. So,
Thank you.
well, you guys all have a great meeting, and if you have it on recording, please send it my way so I can watch it later.
For sure. For
All right.
sure.
Good night, guys. Thank you.
Take care. Good night.
Good luck, Scott.
Thank you.
Okay, and now for our next presenter, Scott, who is an acupuncturist for 25 years and works at the Bello Chiropractic Care in Clifton. I am going to spotlight you. Um, and if you can do similarly to give us an overview of the work you do and what type of patients you see and results and what, all about what you do.
So I'm not sure if everybody knows what acupuncture is, probably, but I'll just touch on it a little bit. Acupuncture is a part of a system of Eastern medicine that dates back over 2,000 years. It originated in China and it was called traditional Chinese medicine, which utilized very fine needles. I have one right here. I don't know if you can see this little guy.
Mm.
Very tiny. Anyway, um, and we use other modalities as well to help heal the body and benefit the body. Um, as a whole, we look at the body and we try to find where imbalances are. We try to look at diet, stress, exercise, try to look at all these different variables and put together a plan to help the patient get better. Um, the ideal goal is to keep the patient balanced and to keep the body functioning at its peak. Um, and Chinese medicine is not only used for certain specific conditions; it's also used as a preventative to help prevent disease and keep the patients healthy. Basically, maintenance, like Dr. Bello was saying, and I like to refer to it as a tune-up because everybody knows they need to get their car tuned up every so often. And it's basically, our bodies are very complex, and our bodies also need a tune-up. Um, let's see here. So some modalities we use with acupuncture, of course, are the acupuncture needles, which I showed you. There's a packet of them. We also use electric stim sometimes, and this is a electric stim unit, and it has wires that we attach to the needles. Can you see those? It's like a positive and negative, like jumper cables. And we hook those to the needles and we stimulate the muscles and the nerves, stuff like that, to get them functioning better. We also do cupping. I don't know if you've heard of cupping. Many people probably have by now, but here are the newer type cups. They're plastic, and it basically is like a suction cup. We use this little gun to suck the air out of it, and it sticks to you. And it basically makes like a hickey, and it's basically moving the blood and helping get rid of toxins in the body. Another technique we use is gua sha. You can use lots of different tools for gua sha. This is just one I have laying around, and we use it to scrape. It doesn't hurt, and we just scrape the areas to help loosen up muscles, get the blood flowing, and help reduce pain. We also have Dr. Bella has a laser at the office, which helps with inflammation and pain as well. We have an infrared heat lamp, which helps with blood flow, helps to loosen up muscles. Basically, kind of makes you feel like you're at the beach, and people love that. um, Acupuncture also uses sometimes herbs and supplementation, stretching, and massage as well. And Dr. Bella did touch on dry needling, which is basically a specific acupuncture technique that focuses on needling trigger points. And so, as acupuncturists, we diagnose a little bit differently than most providers. We go by symptoms. We also look at the tongue to help see what's out of balance in the body. We're looking for different colors and thicknesses of the coating and stuff like that. see if there's any red areas and whatnot. We also look at the pulses on the wrist. There's three pulses on each wrist that we look at, and it tells us what's out of balance in the body. And the benefit list of acupuncture, or how it works, basically helps to relax the muscles once the needle's in. It helps to reduce stress by stimulating different hormones and chemicals in the body. It improves circulation or blood flow. It stimulates the healing process. It's kind of like when you get a cut. Your body knows you got a cut and it needs to send the troops there to help heal the area up. So basically, it does that. It stimulates the body. The body knows it needs to send troops there to help that issue. Um, it helps reduce muscle spasms. It helps reduce pain. It reduces fluid accumulation in the body, boosts the immune system, which I love because I start to feel sick or I feel like a scratchy throat. I give myself some acupuncture, and usually it kicks it right out of my body. So that's an awesome thing. Um, Helps stimulate neurotransmitters. Um, help Helps to balance hormones, as well as stomach acid issues. Um, it also helps with nerve conduction and prevents sickness, like I said. Okay. Um, Acupuncture also helps to regulate organ function. So I had a patient that had her kidney function was low, and I did acupuncture on her, and the kidney rates went up. So it does help with balancing the organs and helping them to function at their best level. Um, so acupuncture can treat so many different things. I think the list of things it can't treat is um, smaller than the list that it can treat. Um, there's definitely We definitely treat pain conditions, basically neck pain, shoulder pain, back pain, sciatica, knee pain, pretty much any area of the body where there's pain, arthritis, bursitis, tendonitis, and other inflammatory conditions. Um, it can help people with asthma. It can help. Today, I had my first allergy patient. She is suffering with allergies already with the spring here. So that's one thing acupuncture works very well at, is helping to treat allergies and help lessen the severity of them. So you're not miserable. um, Acupuncture is really good for headaches and migraines. Usually works really well for these issues. Can help stomach problems, diarrhea, constipation, ulcerative colitis, all different types of issues with that. It's very good for fibromyalgia, neuropathy, um, which helps uh, mainly in the feet and legs and stuff like that, where some people have a lack of circulation and um, the blood's not flowing properly and the nerves aren't getting fed the nutrition. So they're having either numbness or a funny feeling on the bottom of their feet or something like that. That can help those problems. Acupuncture is very effective for skin problems like eczema, psoriasis, stuff like that. Can help that tremendously. Which basically, those type of skin conditions are usually from toxins coming out of the body. So it's very important to be careful of your diet and what you're eating and drinking. Um, Restless leg syndrome is a pretty common occurrence with people, and it can help that as well. It's also very good for infertility, menopause, other issues. Um, with women, I've helped some women that were having infertility problems to get pregnant with acupuncture, which is really awesome. Um, Post stroke, that's once people have a stroke, they lose function on one side of the body. And this acupuncture can be used to stimulate different parts of the brain to regain that function again. It's pretty amazing. It's awesome. Similarly, Bell's palsy um, is a paralysis of one side of the face where the face droops. Sometimes the eye won't close. Um, and sometimes they're not sure what causes it. Sometimes it's a virus or something. But acupuncture needles with the electric stem stimulates those nerves to wake up and um, enables that function to come back. It's pretty awesome. So I could go on and on and on, but there's tons of things that acupuncture can help. Um, I guess I'll just go to questions now because I could just, yeah, it just goes on forever. How long do you leave the cups on? Usually 8 to 10, 15 minutes is the max, I guess, depending on the patient and what you're trying to do.
Thank you, Scott. This was so informative, and it sounds like you really treat numerous types of conditions.
Hmm.
I see a question in the question box that I'm gonna repeat, but just for myself to know, I work with seniors, and a lot of the seniors are struggling with early memory loss. It's not necessarily a diagnosis of
Hmm.
dementia or Alzheimer's, but
Hmm.
just the brain fog. And I think many people,
Yeah.
not just seniors, so many people struggle with brain fog and early short-term memory loss and just remembering things. Does it?
Yes.
I know
Yes.
you said something about neurotransmitters. Does it slow down that? Does it bring back some of the function?
It can because it helps the blood flow in the brain. Um, and yes, it'll help get those neurotransmitters moving again. And so, yes, it can help memory. It can help brain fog. It can help stuff like that, along with some supplements like ginkgo, boba, stuff like that, which help with blood flow in the brain. But yes, absolutely, it's very helpful.
Okay, great. And then someone asked, my doctor recommended acupuncture for fibromyalgia. How does it work?
Yes, acupuncture is really good for fibromyalgia. Um, That's a complex question. Everybody's different, and I'd have to assess as to what is out of balance in that particular person's body. Um, it could be a stress response. It could be, yeah. It's hard to tell without seeing the patient and doing the pulses and the tongue and stuff like that. Um, as to what exactly is out of balance. Sometimes it could be the spleen out of balance or the liver. So yeah, I'd need to see them. I did see another question there.
Yeah.
What was it? I can't see it.
It says, how long are your um, GWA sessions? Where did you study acupuncture?
I studied acupuncture in Long Island. I went to the New York College for holistic. It's they changed the name, but it's called the New York College for health practitioners now. But back then it was called something else. But that's where I went to school. It's right in Syosset, Long Island.
And how long are the sessions?
The gua sha sessions.
Yeah.
Um, that also depends on the patient. Some people you'll scrape them, and they'll get red right away. And some people you have to do it a little bit longer. But I would say 5-10 minutes, something like that. Any other questions?
Someone asked, does it help with sciatica?
Absolutely. Absolutely. Usually, sciatica is coming from a low back issue, or it could be the piriformis pressing on the sciatic nerve. So, in both cases, acupuncture helps very well. Um, Basically, it helps to get rid of the inflammation that is causing the nerve to press. Um, so yeah, it'll definitely help with that. I had sciatica patient today actually, but yeah, it does help with that.
Does anyone else have any questions for Scott?
Anemia, that's a tough one. Not, yeah, not that I know of. That's one of the few things that, yeah, not that I know of. Unless there's a certain cause or reason for that, I, I'm not sure. Yeah, haven't come across that one before.
And when working with someone that comes in for acupuncture, are you usually collaborating with the other medical providers, or is this like a one, like its own category?
Um, we do collaborate together. Absolutely, it's better for the patient if we both know what's going on and we have an open line of communication as to what we're doing to help the patient. Um, and usually, we're both working on the same patient. Uh, so yeah, it's helpful to know how that, yeah, is working. Blood pressure, yes, it can help blood pressure. Um, there are points to help lower blood pressure. Um, you definitely have to be talking to your doctor and regulating your medications as well if that's an issue, if it's very high. But we may be able to bring your medications down after a while of acupuncture. Anything else?
Parkinson's, can it help with Parkinson's?
It can. I have worked on Parkinson's patients. It can help with the shaking and stuff like that. There are points for tremors on the scalp, which relate to the brain. There's a whole science of scalp acupuncture, which focuses on um, the brain and the physiology of the brain and where things line up. So yeah, there are definitely spots for helping with that.
Thank you so much.
You're very welcome. My pleasure.
Thank you for your time. And if people want to reach you, they could reach you at the same number that we just,
Correct.
okay.
So some question. Hold on.
Uh, It says maintain blood pressure once medication lowers, helps keep it low. Oh, yeah, yeah, yeah. That's what you were discussing.
Correct. 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 Mhm.
Thank you so much.
You're very welcome. My pleasure. It's nice
Have a
seeing you.
good night.
All right. Take care. Bye.
Okay, I'm gonna spotlight Kevin now, who's a very familiar face, I believe, to a lot of our community members. He is the owner of A1 Nutrition for 25 years
Hi,
and
everybody.
helped many people with lifestyle changes, nutrition, and supplements.
Mm. Yes, thanks. Thank you so much for having me today. It's an honor. All right, so yeah, so my store, A1 Nutrition, was started by my 92-year-old mother-in-law, who's still living the lifestyle and still doing great. She just did an open mic with us like a couple months ago down in Florida. It's amazing. She's amazing. So my wife and I purchased the store from her in the 90s, and we're still going. And every day, I'm not a doctor. I'm just a humble retailer, but every day my customers come to me and teach me things about nutrition I didn't even know. And I can always, obviously, I've learned so much over the years, so all my years of doing this, so I can easily guide people on the proper forms of calcium and magnesium, because a lot of minerals have different forms that people aren't aware of. So, there's things like little details like that you wouldn't generally know if you went to ShopRite and grabbed a bottle of calcium off the wall, that type of thing. Let's see, what else can we get into here? So, yeah, this is so. For example, like talking about dementia, right? That was mentioned earlier. There are nutrients that will help the brain to stop producing amyloid plaques. Like if you can take certain forms of vitamin E, can slow down dementia. Fish oil is helpful, things like that. So nutrition can play a really vital role in, preventing disease big time. Sometimes it's won't be as powerful as some modern medications if it's something that's really progressed, but it can really help to stop things from forming in the first place if you take care of yourself and eat properly. So that's what I try to do. I try to guide my customers, and we sell lots of foods for specific diets. You have certain allergies, a gluten-free diet, things like that, or there are certain allergens that your children need to avoid. We have things like that. Let's see, what else can I tell you? Um, this isn't so easy being on the camera all of a sudden. I could do this all day long in my store.
What do you do for chronic pain?
So for chronic pain, okay, let's start there. So inflammation, one of the big ones these days, everyone's taking turmeric. It has a nutrient inside of it called curcumin, which is great at reducing inflammation. It's also a very powerful antioxidant, so it's very anti-cancer, it protects the cells, and it also can improve your circulation a little bit. It's a very mild blood thinner, so that it's helpful for blood pressure and other issues as well. So yeah, inflammation is a big one. You can also take fish oil. Healthy fats play a role in having an anti-inflammatory effect. So those are always very helpful. Fish oil supplement is a great place to start, just because it'll just not only is it great for inflammation, but it helps with your brain function as well. So that's always, you get other benefits from it, and improves circulation and blood pressure, and also cholesterol helps to balance your body's cholesterol levels. So that's another bonus there. Other anti-inflammatories, there's an herb called boswellia, which is very popular. People use that for soft tissue inflammation. It can be good for like our rheumatoid arthritis pain. It's also good for colitis and bowel issues because it can reduce the inflammation of the bowel tissue. So people that deal with diverticulitis and colitis will understand that, and that's helpful there. Let's see, other anti-inflammatories. Bromelain's a fun one that comes from pineapple. It's an enzyme found in pineapple, but it's again great for arthritis, whether rheumatoid or just general arthritis. So that's a helpful one. So just increasing your pineapple will have a mild anti-inflammatory effect, and you get good fiber from it. So there's a little bonus there. Another reason to pick up a pineapple. Let's see, even something as simple as ginger is anti-inflammatory, also good for your circulation as well. So that's another helpful tip there. But turmeric really is the big one these days. People love their turmeric. It's pretty powerful as far as like what we have in the old health food store for that. And then people they can use something like, there's an herb called white willow, which is a natural analgesic. So it's similar to an aspirin. So that can kind of take the pain away and reduce inflammation a little bit. And things that improve your circulation can also help to reduce inflammation. So some people will take cayenne pepper as a capsule, or just put a pinch in their food, and that gets the blood flowing, and that can help with inflammation as well. And for whatever reason, I can't see the questions on my side. I don't know if I'm just a bit of a Luddite when it comes to my computer, but if there are any questions, I'm happy to take them.
Someone asked which supplements help with energy and lessen fatigue.
Sure. So a good one would be B12. It's good for fatigue. It also helps to keep the blood healthy. Getting back to someone mentioned anemia before. So B12 is very important for building up our hemoglobin and keeping our blood healthy. So that is good. Iron as well. I'm sorry, what was the question again? I already got off track.
Which supplements help with energy and lessen fatigue?
Right. Okay. So that's going to be the B vitamins again. The B12 is very great for energy. You can use green tea is good because it's really rich in polyphenols. It doesn't have nearly as much nearly as much caffeine as coffee does. So that can also give you a nice even lift and focus and things like that. So that's a nice way to get a little energy lift there. Again, anything that's going to help with your circulation is good for your energy as well. And believe it or not, protein is important for energy. It's used by the body for energy production, carbohydrates. So, you have to make sure you get a nice, good balanced diet. and protein's important. So if, like, if you feel yourself starting to fade in the afternoon, you can just have a handful of nuts, and that should help you build up a little strength there. That's good. Also good for fatigue. Let's see. And fatigue, again, could be caused by many issues. You know, it could be stress related. It could be, again, anemia. That's pretty far flung for that, for fatigue, but it can play a role. Let's see what else off the top of my head here. Fatigue. Green tea, the bees. I know I'm missing something. Oh, green foods, like just anything rich in minerals is, again, good for energy production. So the greens are helpful for that. People are into those green powders these days, like spirulina and wheatgrass and things. These have more concentration of nutrients than your regular watercress salad, so they can help give you a little bit of a lift there. And like green food, like spirulina, for example, it's very rich in protein as well, and it's very easy to digest. So your body can very easily break it down and use the nutrients inside.
Thank you. Someone wants to know, what did you say was similar to Tylenol?
Oh, it was white willow.
White
Again,
willow.
it's going to be a milder version of it, but it is what they make aspirin out of, or at least they used to in the old days. I'm not so sure these days anymore. But yeah, it's a good analgesic, a mild analgesic.
Okay, next question is, what can help with high blood pressure and help lower while on medication?
Sure. Okay, so you can do, yeah, so while you're on the medication, you can do something like even something as simple as hibiscus tea is very rich in magnesium, so that can help to bring it down. Even just taking a magnesium supplement, because that usually doesn't interfere with the medication, though always good to check with the doctor just to be sure. Let's see. Again, the B vitamins you can use those along with your medications, and they're also good for your blood pressure as well. Again, fish oil is usually not, unless you're on like a blood thinning medication, that might be an issue, but usually you can take that along with most medications, and that can help to bring your blood pressure down and improve your circulation.
What is something called kratom? Kratom?
One more time?
Kratom.
Oh, kratom. Yeah, not good. It's toxic. It can really suppress your nervous system to the point where it can stop your respiratory rate. So it can stop you from breathing. So I know people are kind of getting into it lately, but as far as I understand, I really haven't looked into it deeply. But as far as I know, it's not a very safe way to, not safe for consumption. I wouldn't recommend it.
Okay, thank you. Can you take fish oil and turmeric at the same time?
Yes, you can. Not a problem. They even I think there's a company out there that makes a combination of the two. Yeah, but yeah, that's fine. Like I was going to say, the blood thinning action in turmeric is very mild, so it doesn't affect it like fish oil will. So they don't really interfere with each other.
Okay, great. One more question. So there's big talk on ashwagandha.
Mm-hmm.
What do you have to say regarding anxiety for helping with,
Yes.
ashwagandha helping with that?
Yes, it's excellent for that. It's a very good stress guy. It helps lower your cortisol levels. Yes, it has a very good calming effect on the nervous system. Not so much where you get like groggy or sleepy or foggy. It just has a nice even keel way of calming that down. It's excellent for daytime stress and anxiety. It works well. So that is a good one. That one seems to be, as far as like the trendy herbs go, that one actually has punch behind it. So that's a good thing.
Okay.
Yeah. Oh,
Does
also
anyone?
just one more little tidbit.
Yes.
Protein itself is also good for anxiety as well. If you're doing too many sugars and carbohydrates, that can make anxiety worse. So if you're feeling a little extra stressed, have a handful of nuts or something, and then try to do some deep breathing, and you'll feel better a little bit, I would think.
Thank you. Does anyone else have any? Oh, what can cause sudden intolerances, allergies? Suddenly, pineapples make my palms itch, and nightshades as well. Sesame nuts.
Yeah, that's interesting. I don't know what would bring that on all of a sudden. Though I do notice as I age, all my life I never had allergies, and all of a sudden I'm starting to notice like little seasonal allergies and things. So I just don't have the answer to that question. But that is interesting. I'd like to know that myself. And like my son says, he's got a thing where if he eats an apple, his tongue gets a little itchy, but he just ignores it and eats the apple anyway because he knows it's good for him.
Thank you so much. So your store is on Main Avenue.
Yep, we're on Main, on the corner of Main and Van Houten, right across from the Valley National Bank with the big clock on the corner. We're open 7 days a week, 10 to 5 on Sundays. And yeah, I'm always there, and I'm always happy to answer any questions. Anybody, you can call me at any time. I'm there like 5, 6 days a week, and I love to answer questions. So please, anytime. It's never a bother. Just call me up.
Thank you so much for coming on and telling us
Thank you.
about these great products.
Yes, thanks again for having me. I really appreciate it.
Thank you. Okay, I'm gonna spotlight Aliza Dubin, who's our next presenter.
Hi, everybody.
She operates a private hypno coaching practice and is passionate about providing her clients with relief and positive, lasting changes.
Okay. Thank you. I'm really honored to be part of such a wonderful webinar, and I want to thank all the other speakers. A big shout out to Kevin. I do go to his store, and he's very knowledgeable and helpful and kind. I don't know the other presenters, but they sounded really good. Thank you, Sarah, for putting this webinar together. Okay, so a bit about who I am and what I do. So I'm a practicing and licensed hypnotist and life coach. I've been in practice as a hypnotist for over 20 years. I also happen to work for JFS. I work with the seniors, and I love that program. My clients come to see me for a variety of reasons, such as weight loss, stress management, healing from trauma, mood regulation, confidence building, sleep amelioration, overcoming fears and phobias, hypnobirthing, teeth grinding, pain management from migraines, post-surgery, health and wellness when coping with illness, life changes, just really there's many more things. It's just a multitude of things. But before I'm going to discuss how hypnosis can help with chronic pain management, I just wanted to define what hypnosis is. And Kevin had a nice segue. I could really start with the nice relaxation and breathing, but I won't do that right now. Okay. So hypnosis is a natural state in which a person is relaxed in their body and mind. So their subconscious mind is open to receiving positive suggestions. And we bypass the critical, rational thinking, analytical mind. So really, we go into relaxed state, and when the client is in a relaxed state, I can offer suggestions for changes in behaviors, thoughts, perceptions, or emotions. Of course, all of this is discussed during the intake when somebody comes to see me. And all of hypnosis is self-hypnosis. So it's really just like working with the brain and the imagination to help people go to a safe place and achieve goals. And it's not just, I know there's a lot of misconceptions about hypnosis. It's not stage hypnosis. Hypnosis, every session I have with somebody, hypnosis is self-hypnosis, really. So everybody has the skills and the abilities to go into a trance state. And I'll give you some examples. We all daydream right before we fall asleep. Highway hypnosis, if you're driving on the highway and suddenly you get to your destination. Anybody who's a musician, anybody who listens to music, anybody who, if you wash dishes, anything that's like repetitive can be hypnotic. So we all have the ability to tap into that state. So it's not like stage hypnosis. In stage hypnosis, people are highly suggestible, and the hypnotist kind of chooses people from the audience who will, who can cooperate, etc. Okay. When you're in a state of hypnosis, your brain waves go to delta, which is a very relaxed state, similar to right before you fall asleep. So you're relaxed in hypnosis, but you're alert. So you are conscious and alert, but not unconscious. Nothing will happen to you. You won't do anything against your will. It's a matter of just changing your perception, your beliefs, or things that you'd like to work on when you're in that state. And when you're in that state, it elicits the relaxation response. So there's, a benefit which I will talk about. Hypnosis is a skill that everybody can learn. And in terms of chronic pain management with time or with really anything that somebody's coming for, especially stress management, practice helps because we create neural pathways in the brain. The more we practice, the more we change these neurons in the pathways. So we're creating healthy pathways in the brain. You're not sleeping when you're in hypnosis. It's similar to sleep, hence the name, but you're not asleep and you're aware of your surroundings. Okay. I want to talk about some of the validity. I know it's getting late and I know I'm the last speaker, so people might be tired, but there have been studies, in 1958, both the American Medical Association and the American Psychological Association recognized hypnotherapy as a valid medical procedure, an appropriate therapeutic technique. And since 1995, the National Institutes of Health have recommended hypnotherapy as a treatment for chronic pain, including tension headaches, through several studies. So hypnosis is very good for helping people to manage migraines, headaches. Often migraines are related to stress. I have been dealing with my migraines and I've learned through hypnosis to minimize the stress. There's also, by the way, I'm sure Kevin knows, but magnesium is something that can help prevent migraines. You have to know which one to take, and there are other supplements. I've also been practicing homeopathy for almost 35, 36 years. So I know Kevin also, they sell homeopathic remedies, wanted to just mention that. So yeah. Okay, I know I'm not going to get into so much detail. I'd like to just go into, talking about pain. We know that we don't feel pain until it reaches the brain. So the brain can regulate the flow of pain messages, and how you focus your attention, what your mood is, and the way you view your situation can open or close the pain gates. So this is something that we can do in hypnosis. And it's also interesting to note that the signals for pain and depression come from the same part of the brain. So oftentimes people will come in with chronic pain and they will have depression. So hypnosis can help with that. So we're managing the pain by disrupting the pain signals that come from other parts of the brain, of the body. And that's really important. Let me just go to here. So why do people seek hypnosis as a pain management modality? Well, a lot of times pain medication, they might be, they can't tolerate it, or it isn't working, or it's addictive. Sometimes people just have tried everything. Chronic pain can impact one's life in many areas, such as sleep disturbances, loss of work, feelings of hopelessness. It can affect your self-esteem. So when somebody comes in for, during an intake, when they come to see me, it's important that I understand, the pain and what else is going on with the person. It's a very holistic approach. It's also very important that I monitor the client's success and see what's working for the client and what is not. Something really important to understand is that a lot of times people will have headaches and, migraines and, chest pain, backaches. And these are kind of like physical manifestations of something emotional going on. So a lot of times when emotions are difficult to deal with, the brain can't handle it, or the client's not ready to process these overwhelming emotions. So it's a protective mechanism, and somebody might develop some kind of physical sensation. But again, this is not like an acute pain, like somebody having a heart attack. So we just have to, pain is for a reason. So we have to really address it on a holistic, broad level and really understand what's going on with the person. I would, when a client comes to see me, I would need medical clearance to do hypnosis. I would need a medical evaluation from the doctor, just for safety reasons. Clients come in for hypnobirthing, so they can have a better, an easier birth. They can feel calm, so they don't have to have as much, meds. I didn't have any, pain meds in my with my birth. So, but it can be helpful with that. Sometimes people have, they grind their jaw at night and they can't sleep. So I can help them with hypnosis to relax their jaw so they can sleep and not grind their teeth. So I think I talked about what happens in a session. I also discover what the person's learning style is, whether they're kinesthetic, visual, auditory, if they have some phobias. I don't want to when I take somebody to a safe place, that's one of the techniques so they can go into relaxed state. I want to make sure if somebody is afraid of water, I don't want to take them to the beach because that might be very difficult. That might be not good for them. Or if somebody is afraid of heights, I don't want to have them imagining going downstairs and feeling calm. That would be terrifying for them. Or if somebody has difficulty walking downstairs, that wouldn't be appropriate. So we have to look at it as an individualized approach. Everybody's different, everybody's unique. Okay, so I was speaking about how we can help somebody to cultivate a safe place in their mind. And we want to engage all the senses in that. Again, there's communication also in hypnosis. I can talk to my client while they're in hypnosis. You can have your eyes open or closed. I also teach self-hypnosis so people can develop the skills of learning self-relaxation and meditation. The difference between meditation and one of the differences between meditation and hypnosis is that hypnosis is very goal-oriented. So we always discuss what the goals are. And again, there's ways of reinforcing what the client has learned through teaching self-hypnosis. I give my clients exercises to do at home to practice self-hypnosis. So with pain management, you can start to notice differences in energy levels or in pain flares, and you can manage them because the pain doesn't always just stay high. It can be elevated and spike. And when it elevates and spikes, the client, because the client has been practicing self-relaxation and going to a safe place, they can choose how they want to respond. So we can lower the experience of pain. We can cut down on pain medication. These are some of the benefits. You can have an analgesic response. They say that it's like a 30% response from hypnosis, which is what you get from an opioid. I don't know, all of the details, but sometimes, again, medications can pose a risk. It can help with post-surgery pain. It can help the client to just cope with the pain they have, like I mentioned. You're activating the parasympathetic nervous system, the relaxation response. So if somebody learns relaxation and techniques, you can tap into the body's natural abilities to heal by building the immune system. So I've worked with cancer patients to help them, just with well-being and to help, promote, imagining like white blood cells, coming in and helping them. Can increase feelings of well-being. It can increase feelings of empowerment and control. One of the most important things is that when you have chronic pain, you can feel hopeless and you can feel, that, you're a victim or you can't get control of your life because it affects your life in so many areas. It affects your work. It affects your relationships. It affects your sleep. It affects, just your activities of daily living. So it's really important to give clients some hope that they can actually feel better, that, that they do have some control. That's really something that's really, really important to give that support. And it's amazing that, we don't think we're going to use the power of our mind to block off pain. If somebody has pain in their legs, they can learn through different techniques to block that off. It's also going to help with sleep. I'm not going to go into all the details because it's way beyond the scope of this and there's a lot, but there's different techniques. Once somebody is in a trance state, they go into relaxed state. I can use let's see, future pacing. Somebody could imagine himself or herself in the future, feeling good, looking good, being pain-free, walking easily, etc. Progressive muscle relaxation is taught. We can displace the pain. So the pain could be moved from one area to another. I use somatic healing. There's gradual pain reduction. So you can imagine somebody have a dial, somebody imagines a dial, I mean, a radio, an old radio in front of them, and there's two knobs. One can like increase comfort and one can decrease pain. And I've done that a lot with people, not just for physical pain, but for emotions too, to help them like, tone down the negativity or, increase feelings of well-being and self-esteem. So it doesn't mean that all the pain's going to go, but you can reduce the pain. And again, this is all through practicing and creating those neural pathways and making them stronger. There's also something called glove anesthesia. So we can actually help the client to like learn how to numb the pain by kind of making the hand be like, be numb, and then you can place that hand on the area that is sore. Of course, when I take the client out of hypnosis, they will not have that numbness. There's, healing lights. Is somebody not muted? Because there's some, okay. Healing waters or healing light. You can allow a sense of blue, cool liquid to move all the way from the top of your spine to your toes and run through your body, or it could be the body part that's bothering you, or if your shoulder's tense or sore, it could be light, hitting that area, soothing it, or bathing in warm water. Again, this is like a stimulus response because your brain has been trained. So the more you practice relaxation, the more you could master it, and everybody can do it. We can do, we can take the pain and we can move it. We can imagine how large it is, what it looks like, what shape it is. We can take it out of the body. We could throw it away. We could throw it into the water, into the sea, whatever. There's a lot of different techniques. The most important thing or the most common thing that we do always is to help facilitate taking the client into a safe place and engaging all the senses. So as a hypnotist, I'll start to talk slower. My voice just started to get a little calmer because I was a little nervous. This is the first time I'm presenting. So you could see like when I'm talking slower, people might be more relaxed, or I could easily take you into a hypnotic, session, but I'm just doing that to prove a point here to illustrate. Again, hypnosis can replace the use of opioids, which can be dangerous. I don't know enough about these things to really talk about it, but I do want to just mention again that managing chronic pain is a multidisciplinary approach. As you can see, we've had different speakers here, so you can incorporate, acupuncture, chiropractic, physical therapy, movement therapy, homeopathy, herbs, eating well, massage therapists, hypnosis. There's so many modalities. So we really just want to bring hope to people so that they can have get back some autonomy, some control, because it's control in the sense of feeling like they can get back, get their lives back. And let's just see if there was something else I wanted to say. Just like, often pain it's layered. It's not just, there's many things about the pain, and sometimes just regular doctors might say they can't help you, and then people could feel hopeless and they don't know what to do. So they might come to a hypnotist, just as they might come to a hypnotist after, seeing a therapist and not feeling like they have results. Let's see. I think I covered most of what I wanted to say. I know this was a lot of information, and I know I hope it wasn't too much. But if you have questions.
This was fascinating. I really did not know all of this, and I'm so happy you spoke about this all. It sounds really incredible, and I'm lucky to work with Aliza, so she might get a lot of questions from me, but
Okay. And
so
I
I
have time
wanted
to prepare.
if so I would love to take questions, I mean, for Aliza to be able to answer questions from the audience, if anyone has.
Too scary. Nobody's asking me a question. Nobody has any questions? Okay, it's interesting.
How much is how long is a session?
So generally speaking, the first session is an hour and a half because I do an intake. If I haven't done a little bit of an intake on the phone, usually when somebody contacts me, I do just, offer free whatever 15-minute consultation, just because I want to hear if I can help them. And then once we make an appointment, the first session is usually an hour and a half. There's more thorough intake that's involved. And then I might even do some hypnosis, depending on, what's going on. But I definitely, each session is usually 1 hour.
And do people need multiple sessions, or is it like people come for a one-time thing that they're stressed about and then move on, or is there a certain
Right,
amount?
right. I mean, so honestly, like sometimes somebody will come in with a presenting problem. Let's say that they want to lose weight. Let's say that the weight that they have is causing chronic pain, or it's, there's inflammation, et cetera, or whatever. But a lot of times there's underlying, issues that are going on. So I can address that. So it really depends. It's very goal oriented, but it all depends. I had somebody come in who was afraid of putting on makeup, and in one session, I was able to help her. I had somebody come in who was afraid of getting, needles. That's for the acupuncturist, and she didn't go for acupuncture, but I was able to help her. So it's generally, what was the question?
If it's like a one-time
Oh,
session or a
right.
series of, so it
It's
depends on the
really,
case, it sounds like.
yeah, it sounds like it depends. It's so individualized, and people, often have other things going on. So it's really, it really depends. I couldn't really say if they're coming in for like weight loss, it could be like 4 sessions. It can be very like that. But if they're coming in for other things, I mean, trauma, it's very, it depends. And it depends how much support somebody wants. But if it's very goal oriented, like I'm afraid of flying, I'm not afraid of flying, but if somebody comes in because they have fear of flying, there's a desensitization process that I do while the client is in hypnosis. And there's a lot of success with that. And that's, could be 1 session, could be 2 sessions. So it all depends. Really, I'd have to talk to the person.
Very cool. Someone wrote, if you have multiple conditions that contribute to the chronic pain and issues, is it still something that can be helped?
If you have multiple conditions going on,
Yeah.
I mean, I guess sure. I mean, it depends. We would address them, and the different parts of the brain are affected differently by different suggestions. So one modality, might not actually work, and then another one might. So yes, it's beneficial. Again, I'd have to
Assess.
assess.
Someone else asked, how can it help lowering blood pressure, or can you teach people techniques when they are in elevating situations or trying to lower and reduce or maintain once
Yeah.
it's lowered?
Well, I mean, when you use the power of your mind and your imagination and you start to slow down as you as you elicit the relaxation response, the parasympathetic nervous system. I mean, in hypnosis, you kind of equilibrate the sympathetic nervous system and the parasympathetic nervous system. So you can, the person will relax, and that could actually help. And you can give suggestions to maintain the blood pressure. Also, by the way, exercise does help. So you're reducing the stress, so, trying to help the person to remain calm will have an effect on the blood pressure. I mean, there's been studies with biofeedback. about that. So yes, there are things that happen when somebody goes into a trance, their breathing starts to slow down. I forgot to mention all that, their blood pressure, it's a good question, their pulse rate, naturally, responses from being in the hypnotic state, these would be elicited. So, your pulse rate, your heart rate, everything kind of slows down. So the body goes into this nice equilibrium. So that's a very good question.
Does anyone else have any questions for Aliza?
And if anybody wanted to contact me, do you want to give
Yeah,
out?
let me write your number in the chat.
Sure.
Okay, what is it?
It's 201
Okay.
757
Mm-hmm.
7014. And I have an office in Nutley.
Okay, that's local.
Yeah.
That's local. Okay. Thank you so much, everyone, for joining. Thank you to our presenters. Each one had so much information to give over. And stay tuned for more of our webinars. Whoever signed up into this one, I have your email addresses, and you could take a look at our website, jfsclifton.org/golden resources, to find out more about upcoming webinars. And if you have any questions for the presenters, I do have their information, and I'm happy to share. If you email me, that if you forgot to write down someone's number, I can share it with you. They were very gracious to give it. So, yeah, I hope everyone has a good night.
Thank you so much.
And the
Thank you,
recording will
Sarah.
be up. Okay. Good night.
Hey, everybody.
Thank you so much. Bye-bye.
Thank
Good
you.
night.
You've been wonderful.
Good
Good
night.
night.
Okay, take care, everybody.